The value of coalitions is, I think, critical to some of the solutions to, again, improving health, improving healthcare, and lowering costs. I think a principle of coalitions starts with this idea that all health and healthcare is local. If you look at markets around the country, whether it's health status or the organization of healthcare delivery or quality of care or utilization of services, we find a lot of variation. And so each market is unique and different. And so we need to focus our activities not through national strategies. There's some things national reform can do for us to empower local communities. But the answers and the solutions are going to come in those local markets. The second thing why coalitions are important as a principle is that there's only so much influence an individual employer can have, particularly on the larger healthcare delivery system. They're a very small segment of that delivery system. They think they pay a lot out of their own pockets for healthcare, and they do, but it represents a tiny percentage of the healthcare costs and services in that community. So there is this critical need for employers to sort of aggregate their voice, their purchasing power and authority to get the attention of the provider community as a key constituency and consumer of healthcare services. And I'll tell you, because I see it across the country where the National Association of Employer Purchaser-Based Coalitions, we have 60 around the country, when a coalition gets established, and even if there are a few employers at the table, some key anchor employers, they have an amplifying effect. All the providers, all the other stakeholders want to know what the employer community is up to in establishing that coalition and want to come to that coalition's table to participate in a dialogue. So again, a coalition can be provide wonderful value in bringing the different stakeholders together because we have such a stake, again, in improving health and improving healthcare and lowering costs.